guys, Dr. Cat here with Amara Day Spa. I just wanted to talk about our Aquagold and Aquaglow. So first let me show you this really cool reservoir. It's a new technology in the field of medical aesthetics. This cute little reservoir can contain a concoction of our making in this little reservoir, and then the top is where the magic happens. So we make our little concoction in here of different things to do different effects, and then the top has 20 gold hollow needles to be able to inject it. The cool thing about this is that it injects it all into the same depth, and that depth is right in the skin layer. So for the Aquaglow solution that we like to use, we use a little bit of filler, we use a little bit of numbing medication, we use a little bit of saline, and we use a little bit of Botox, or this is Dysport. And what that will do is inject filler, which is hyaluronic acid, into the skin level. That's going to help hydrate the skin, because hyaluronic acid is a sugar that our skin produces naturally, and it draws water into it. So we're putting something that draws water right into the skin level. So what that translates to is that we're going to be able to draw moisture in and lock it in right at the skin to help plump up fine lines and wrinkles and help with dry skin. The other cool thing is by adding some Dysport or Botox, we're going down to that skin level and affecting the muscle that controls the sweat gland or the oil gland. It's really cool. So it's not going to stop the movement of your face, it's going to stop the pumping of the oil gland or the sweat gland. So that's going to help with oiliness or sweatiness on the face. So it's a really cool combination. They work really well together because you get that nice hydrated look, and then you also aren't going to be overproducing oil, which a lot of times our skin does if it's feeling dry, and then we think we have oily skin when really we just have skin that needs hydration, so it's overproducing oil. So it can also help with acne, so you'll get to see us do an acne treatment as well. So I'm going to get started mixing up my whole concoction here. That's what takes the longest time of the whole entire process. Okay, we have our patient here. I've already had her remove her makeup, and we've cleaned all of her skin off with some alcohol to make sure that we prevent infection the best way we can, since we are using these little tiny needles. So I've got our concoction here that has filler and Dysport, a little bit of numbing medicine, and a little bit of saline to help it go over the whole area. I always talk with my patients and find out their trouble areas, so areas of dry skin, areas of oily skin, areas where they get sweaty. Those three things that we're addressing here, we can go over those areas multiple times and make sure we're focusing on those areas. So to do the face, neck, and décolleté, it takes just a second to get everything flowing here. Are you doing all right?
Yeah.
So while the bottle is priming, I'm poking a few holes here, and then sometimes we have to unscrew it to help regulate the pressure. One more and we should be good to go. So the little plunger that is on the bottle helps all the needles stay at exactly the same distance, and also helps spread the solution. So I go up into the hairline. How are you doing comfort-wise?
It's so good. It just feels like a rough exfoliation, basically.
Good. So the numbing medication that I put in, we'll turn your head a little bit, helps on the subsequent passes. It's not doing anything yet because it's being injected right now. But any other areas that I go around and focus on, it will be helping to numb those areas, because as you can imagine, if you're poking an area a whole bunch of times, it might get a little irritating after a while. You'll notice her skin gets kind of wet. That's totally normal. Still doing okay?
Yeah.
We're really excited to see it help with acne as well. A lot of people don't know this, but when you turn the magical age of 20, your acne doesn't magically go away. Most people have acne into their 30s, even 40s and 50s. And so a lot of times it's from the oil production in our skin. So if we can quiet that down, then we can help with the acne. Okay, suck your lips in for me. Doing all right?
Mm-hmm.
Okay, top lip is kind of rough. You okay still?
Mm-hmm.
You can relax your lips now. I'm going to do the neck. I do find that these needles have to get their pressure regulated a lot. I also like to include the décolleté in the treatment because the filler can help with our aging skin. And so it will help fill in kind of that crepey skin that we can get on our chest. Rochelle's skin looks beautiful, but this will help keep it that way. How's your comfort level?
It's
Doing
good.
okay?
Yeah.
Just still kind of feels like a exfoliation, like scrubby gloves or something?
Basically feels like a sugar scrub.
Okay. Yeah, we've done it with both numbing and without numbing, and I think it's just fine without.
Mm-hmm.
So you can see she turns the tiniest bit red in some areas just from the irritation, but it's really temporary. So now that her forehead has had a little chance to have some of that numbing medicine work, we're going to go back and do more. Does it feel any different this time? Any better or worse?
It's pretty much the same, but you can
Okay.
definitely feel like it's a bit
Bit
dull.
fuzzy?
Yeah.
Okay. Good. These needles are made with 24 karat gold, and they're hollow, so they are actually injecting. That's one of the differences between